Have you ever planned a lovely evening, had a generous dinner, maybe a glass of wine? Everything feels romantic. And then, halfway through sex, your erection fades like someone quietly turned the dimmer switch down? And the worst part is you're thinking, why now? Why after a nice meal? Am I getting old overnight? That moment can feel brutally personal, but I want you to hear this clearly. In many men over 55, this isn't about attraction and it isn't a character flaw. It's about blood flow priority, and your body makes a very blunt decision after a big dinner. Today I'm going to explain the one brutal reason nobody tells men 55 plus what's actually happening inside your blood vessels and how to fix the pattern without starving yourself or turning date night into a medical appointment. Stay with me, because in a moment, I'll show you the easiest way to prove to yourself whether dinner is the trigger or whether something deeper is going on. Welcome back. My name is Victoria Ashford, urologist, and on this channel we talk about men's health in a calm, practical way, without embarrassment and without nonsense. If you find this video helpful, do give it a like, share it with someone who keeps blaming age, and subscribe for more straightforward guidance. Now, here's the first micro hook. Before the end of this video, you'll know exactly why a heavy meal can steal an erection, even if your desire is strong. And I'll give you a simple dinner tweak that can improve things the very next time. Let's start with the brutal reason, said plainly. After dinner, especially a large, rich dinner, your body sends more blood to your digestive system to process the meal. That's normal physiology. But here's the brutal bit. If you're 55 plus and your blood vessels are stiffer than they used to be, you often don't have enough spare blood flow and vessel flexibility to support both digestion and a strong erection at the same time. Your body has to choose where the blood goes, and digestion frequently wins. It's not romantic, but it is real. And in a moment, I'll explain why the same dinner that never bothered you at 35 can suddenly sabotage you at 58. An erection is a blood flow event, not a motivation event. When you're aroused, your body releases nitric oxide, which is a tiny chemical signal that tells blood vessels to relax and widen, so blood can rush into the erectile tissue, which is the spongy tissue in the penis that fills with blood to create firmness. To maintain an erection, you need steady inflow, and the veins need to be compressed enough to keep blood from leaking back out too quickly. Now, after a big meal, blood flow is diverted to the gut, and the nervous system often shifts towards rest and digest. Rest and digest sounds like it should help, and it can, but the catch is this. Rest and digest prioritizes the stomach and intestines, not necessarily the penis, especially if your circulation is already working harder than it used to. Quick question. Does this happen mostly on nights with a big dinner, but less on mornings or afternoons? Hold that thought, because that timing is a massive clue. Now let's make this vivid, because understanding sticks better when you can picture it. Imagine your circulation like a budget. When you're younger, you have a bigger budget and your blood vessels are more elastic, meaning they can widen quickly when needed. Elastic means springy and responsive, like a good balloon. After 55, many men have some degree of endothelial dysfunction, which simply means the inner lining of the blood vessels isn't as responsive as it used to be. It becomes slower to widen, especially after years of blood pressure, cholesterol issues, smoking history, diabetes, stress, or simply aging. So when dinner demands more blood supply for digestion, your system can't increase the budget as easily. The penis is a smaller vascular bed, and it loses the competition. And stay with me, because next I'll tell you the one type of meal that is most likely to trigger this in men 55 plus. The meal most likely to trigger it is the heavy, high-fat, high-carbohydrate combination. Think big portions, creamy sauces, fried foods, lots of bread, pasta, potatoes, dessert, and alcohol on top. Why that combination? Because it creates a strong postprandial response. Postprandial just means after eating. After a large meal, your body releases insulin, which is the hormone that moves sugar from your blood into your cells. If you have insulin resistance, which means your cells don't respond as well to insulin, your body has to produce more of it, and blood sugar can stay higher for longer. That metabolic strain can worsen blood vessel function in the short term, making it harder for nitric oxide signaling to work properly, right when you want it. In a moment, I'll explain why this can feel like I was hard, then suddenly I wasn't, rather than a gradual fade. Pattern interrupt. Picture this scenario. A 60-year-old plans a date night, has a lovely steak, chips, a rich pudding, and 2 glasses of wine. He feels sleepy, but also excited. Sex starts fine, and then 10 minutes in, he fades. His brain immediately goes, "That's it, I'm failing." He starts trying harder, bracing, holding his breath, checking constantly, and that anxiety spike steals even more blood flow. Not because he's weak, but because adrenaline, which is a stress hormone that prepares your body for action, tends to tighten blood vessels. It's the opposite of what erections need. Now here's the micro hook. In a moment, I'll show you how to stop the panic surge from turning a digestion issue into a full-blown performance loop. Before we fix it, let's clear up a myth that keeps men stuck. Most people think, if I go soft after dinner, it must be low testosterone. Testosterone is the main male sex hormone, and yes, it affects libido, which is desire. But the most common reason men go soft mid-sex after a meal is not testosterone. It's hemodynamics, which simply means blood flow mechanics. You can have perfectly decent testosterone and still struggle if your blood vessels are stiff or your nervous system is spiking after a heavy meal. So don't let your brain leap to the most frightening explanation. Ask the more useful question. Is this a blood flow timing problem? And stay with me, because next I'll give you the quickest at-home way to test that, without any gadgets. Here's the test. Compare 3 moments over 1 week. 1 attempt in the morning or early afternoon, 1 attempt before dinner, and 1 attempt within an hour or 2 after a large dinner. You're not trying to perform on command, you're observing your body's patterns. If erections are noticeably better earlier in the day and worse after dinner, that strongly suggests the after-dinner physiology is the driver. And that's actually good news, because patterns can be changed. Viewer participation prompt. Be honest with yourself. Does it almost never happen during a lazy morning, but often happens after a big evening meal? That pattern is so common, and men rarely connect the dots. In a moment, I'll explain why lying down after dinner makes the problem worse for many men. When you lie down right after a heavy meal, you change the pressure and blood flow distribution in the body, and you can worsen reflux, which is when stomach acid travels upwards and causes burning or discomfort. Reflux discomfort can trigger subtle stress signals, and stress signals can nudge the sympathetic nervous system, which is your alert system. Also, lying down can make you feel sleepier, and sleepiness blunts arousal and attention. And there's another sneaky factor. The gut is literally expanding and working, and you may feel bloated. Bloating can increase abdominal pressure and contribute to pelvic floor tension. Pelvic floor tension means the sling of muscles under the pelvis is tightening, and tight pelvic floor muscles can make erections less stable in some men by affecting blood flow and nerve signaling. Now here's another hook. In a moment, I'll show you the simplest after-dinner habit that improves blood flow without killing the romance. That habit is a gentle 10-minute walk. Not a power march, not a workout, just a relaxed stroll. Why does that help? Because it improves glucose handling, meaning your body moves sugar out of the blood more smoothly, and it supports circulation without spiking stress hormones. It also reduces that heavy, sleepy, food coma feeling. Food coma is basically post-meal sleepiness, often linked with blood flow going to digestion and blood sugar swings. Many men are shocked that a short walk changes how their body feels. Quick question. After a big meal, do you feel warm, heavy, and a bit drowsy? That's the exact state where erections often become less reliable. In a moment, I'll tell you why alcohol makes this pattern dramatically worse after 55, even if you think it helps you relax. Alcohol feels relaxing because it reduces inhibition in the brain, but physiologically it can sabotage erections in several ways. It can dehydrate you, meaning you have less blood volume available to maintain firmness. It can blunt nerve signaling, meaning arousal and the reflexes involved in erection can be less crisp. And it can worsen sleepiness after dinner. Plus, alcohol can lead to more shallow breathing and less awareness of tension, which can feed into a fade mid-sex. None of this means you can never have a drink. It means if your erections are most unreliable after dinner, alcohol is often the accelerant on an already smoldering fire. And stay with me, because next I'll share the 2-drink trap that catches men 55 plus without them noticing. The 2-drink trap is this. 1 drink might not affect you much, but 2 drinks on top of a heavy meal can tip you into a state where your blood vessels are not responding well and your nervous system is drifting towards drowsiness and reduced sensitivity. Your desire might still be there, but your body's execution is slower. Then, if you notice the erection fading, you tense, you check, you worry, and you spike adrenaline, which tightens blood vessels. It becomes a tug-of-war between drowsy digestion and anxious adrenaline. Neither state is the calm, steady arousal physiology you want. In a moment, I'll show you the discrete technique that stops you from bracing yourself into softness. Pattern interrupt. Do this with me now because it's surprisingly effective. Unclench your jaw, drop your shoulders, and breathe out slowly as if you're quietly sighing. That longer exhale signals safety to the nervous system. It nudges you towards the parasympathetic system, which is your calm, restorative gear that supports arousal. Many men hold their breath during effort, and breath holding can trigger the sympathetic system, your alert gear, which is not erection-friendly. The goal is not big, dramatic breathing. It's a slow, quiet exhale. If you practice that after dinner, you'll be better at it in bed without thinking. Now, here's another hook. In a moment, I'll explain why this dinner fade is sometimes the first sign of vascular problems and why you shouldn't ignore it if it's new. This is important, and I want to say it calmly, not fearfully. Erectile dysfunction can sometimes be an early sign of vascular disease, meaning disease of the blood vessels, because penile arteries are small and may show problems earlier than larger arteries. So if you're 55 plus and you suddenly notice your erections are significantly worse, especially if you also get breathless more easily, have chest tightness, or leg pain when walking, it's worth a proper health check. If you have chest pain, sudden severe shortness of breath, fainting, or symptoms that could suggest a heart attack or stroke, that is an emergency, and you should seek urgent medical help immediately. For most men, though, the dinner pattern simply reveals reduced vascular reserve, which is the body's ability to meet extra demand. And in a moment, I'll show you how to tell whether this is mostly timing and meal size, or whether it's happening across the board. Here's a simple clue. If you still get decent morning erections, that suggests the plumbing can work, and the evening problem is more about triggers like heavy meals, alcohol, fatigue, stress, or medication timing. Morning erections are useful because they're less influenced by performance pressure and more influenced by sleep and baseline blood flow. If morning erections are rare or weak too, that can point more strongly towards vascular issues, diabetes, low testosterone, medication effects, or other health factors. Again, this is not self-diagnosis, it's pattern recognition. Viewer participation prompt. Over the next week, notice whether morning erections show up more days than not. It's a quiet but powerful data point. And stay with me, because next we're going to make dinner erection-friendly without turning it into salad and sadness. Let's talk about what to do, practically, because you deserve solutions. The first lever is portion size. You don't have to eat tiny meals forever, but if sex is likely after dinner, the meal needs to be moderate, not feast. A moderate meal reduces digestive blood demand and reduces post-meal sleepiness. Second lever is composition. A plate that's heavy on refined carbs like white bread, pasta, chips, and dessert creates bigger blood sugar swings and more insulin demand. Refined carbs are carbohydrates that digest quickly and spike blood sugar. In many men, that temporarily worsens blood vessel responsiveness. Instead, aim for protein and vegetables first, with a smaller portion of carbs. Protein is the building material in food, and it tends to keep blood sugar steadier. Third lever is timing. If you want sex, give yourself at least 90 minutes after eating before you expect peak performance. Not because you're broken, but because physiology needs time. And here's the micro hook. In a moment, I'll give you a date night plate that supports blood flow and still feels like a treat. A date night plate could be something like grilled fish or chicken, a large portion of colorful vegetables, and a smaller serving of potatoes or rice, with olive oil rather than creamy sauces. Olive oil contains monounsaturated fats, which are generally friendlier to blood vessel health than heavily processed trans fats. Trans fats are artificial fats that can harm blood vessels and raise inflammation. If you want dessert, keep it light or shift dessert to earlier in the day and make the evening about connection instead. I know that sounds unromantic, but so is going soft mid-sex and spiraling into panic, isn't it? The goal is not perfection, it's reducing the trigger load. Now here's another hook. In a moment, I'll tell you the single most overlooked reason dinner kills erections in men 55 plus, and it's not the food itself. The overlooked reason is fatigue. Many men over 55 are simply tired in the evening, and tiredness lowers arousal, reduces focus on sensation, and increases the likelihood of shallow breathing and bracing. If you have sleep apnea, which is when breathing repeatedly pauses during sleep, you can be even more fatigued, and your blood vessel health can be affected by lower oxygen at night. Snoring, waking unrefreshed, and daytime sleepiness are clues. If you're doing everything right with dinner, but you're chronically exhausted, the evening will remain your weakest window. This is why some couples do much better with intimacy earlier in the day or before dinner. Quick question. If you're honest, do you feel at your best at 9 p.m. or at 9 a.m.? In a moment, I'll show you a simple way to move intimacy earlier without it feeling awkward or forced. One option is to shift the sequence. Intimacy first, dinner after. It sounds obvious, but many couples never consider it because of habit. Another option is to plan a lighter dinner on nights where you want sex and save the big feast for nights where sex isn't the goal. You're not scheduling romance like a dentist appointment. You're aligning romance with your biology, and biology is not negotiable. Another simple trick is to do a short walk together after dinner as part of the evening, which keeps you connected and also helps physiology. Now here's a pattern interrupt micro recap in plain English. After a heavy dinner, blood is prioritized to digestion. Over 55, blood vessels are often less flexible, so erections struggle to compete. Add alcohol and fatigue, and the system tips. The fix is smaller, smarter meals, better timing, less alcohol, a short walk, and staying calm rather than panicking. And stay with me, because next I'll explain the medication timing factor that surprises a lot of men. Some medications can affect erections, and timing can matter. For example, some blood pressure medicines can contribute depending on the type and the person. Beta blockers are a class of medicines that slow the heart rate and reduce blood pressure, and they can affect sexual function in some men. Antidepressants can also affect erection and orgasm. This does not mean you should stop medication. It means if the problem is new and coincides with a medication change, speak with your prescriber. Also, if you use PDE5 inhibitors, which are erection tablets like sildenafil or tadalafil that help blood vessels stay relaxed, it matters how you use them. Some work less effectively after a very heavy meal because absorption is delayed. Absorption simply means how the medicine gets into your bloodstream. And a critical safety note: if you take nitrates, which are medicines for chest pain, such as glyceryl trinitrate, you must not use PDE5 inhibitors because the combination can cause dangerously low blood pressure. That's important. Now here's the hook. In a moment, I'll give you the 3-step rescue plan for the exact moment you feel yourself fading after dinner, so you don't spiral. Here's the 3-step rescue plan, and it's discreet. Step 1, stop checking. The "am I still hard?" check triggers anxiety, and anxiety triggers adrenaline, and adrenaline tightens blood vessels. Step 2, slow down and breathe out longer than you breathe in. That long exhale nudges the calm system back on. Step 3, reduce effort for 20 seconds and focus on sensation, not performance. Sensation keeps you in your body. Performance keeps you in your head. If you can do that for even half a minute, many men notice the erection stabilizes or returns, especially if the initial problem was a nervous system surge layered on top of digestion. And if it doesn't return, you've still avoided turning one moment into a trauma memory. That matters more than you think. Stay with me, because next I'll tell you the one brutal question every man 55 plus needs to ask himself about dinner and erections. And it's not about willpower. The brutal question is, am I trying to make my body do 2 big jobs at the same time when it no longer has the same reserve? Digestion of a large meal is a big job. Sex is also a job for the cardiovascular system. Cardiovascular means heart and blood vessels. When you were 30, you could do both effortlessly. After 55, you might need to choose smaller meal if you want sex, or big meal if you're happy to cuddle and sleep. That's not defeat, that's wisdom. And once you accept it, the shame often melts away, and the body responds better. Now, here's another hook. In a few minutes, I'll connect everything into a simple 7-day date-night reset. You can try without changing your whole life. Pattern interrupt. Another mini-story, anonymized. I once spoke with a man of 67 who told me, "It's always after we go out for dinner. At home on weekends, it's much better." That detail mattered. He wasn't getting worse. He was bumping into a predictable trigger. When he and his partner made one change, lighter dinners when they wanted intimacy, and bigger dinners when they didn't, his confidence returned. Then the anxiety dropped, and the improvements became even more consistent. This is why I'm so keen for you to see patterns rather than labels. Now, stay with me, because next I'll explain why desserts are especially problematic for this after-dinner fade, even if you don't have diabetes. Desserts can trigger a sharper blood sugar rise, and that can make you feel sleepy, foggy, and less responsive. Even without diabetes, many people have some degree of glucose intolerance as they age, which simply means the body handles sugar less smoothly. Big sugar hits can also increase inflammation, which is your body's irritation response, and inflammation is not friendly to blood vessel function. Plus, dessert often comes with more alcohol or coffee, and caffeine late can worsen sleep, which then worsens erections the next day. So dessert can create a triple whammy. Blood sugar swing now, poor sleep later, worse arousal tomorrow. If you love dessert, consider shifting it earlier in the day or keeping it smaller. You're not being punished. You're choosing what you want your body to be good at later. Now here's the hook. In a moment, I'll share the single best swap that keeps dinner satisfying but reduces the blood flow steal. One of the best swaps is to keep the pleasure but reduce the volume and the refined carbs. For example, keep the main dish you enjoy, but have the bread and chips, double the vegetables, and skip the heavy dessert, or share dessert, or have berries and yogurt. It's not about healthy as a moral badge. It's about controlling the post-meal physiology. Another powerful swap is to choose a starter salad and a main, and skip the extra sides. And if you're thinking, "But I'm a man, I want a proper meal," remember, a proper meal is the one that supports the night you actually want to have. And stay with me, because next I'll tell you when this after-dinner erectile fade is a reason to get checked medically, even if you can sometimes perform. If you notice a significant change over a short period, if you're losing erections in situations where you never used to, if you have pain, curvature, or difficulty with orgasm, it's worth assessment. If you also have symptoms like chest discomfort on exertion, unusual breathlessness, or leg pain when walking that eases with rest, those can be signs of circulation issues, and you should speak with your doctor promptly. Again, if there are symptoms suggesting a heart attack or stroke, sudden severe chest pain, fainting, one-sided weakness, severe breathlessness, seek urgent emergency help. For most men, though, the dinner pattern is a nudge to optimize vascular health, blood pressure, cholesterol, blood sugar, sleep, and activity. Which brings me to the next micro hook. In a moment, I'll give you a 7-day plan that improves dinner time blood flow dynamics without turning you into a monk. Here's the 7-day date night reset. For 1 week, on any night where sex is likely, choose a moderate dinner and finish eating at least 90 minutes before intimacy. Keep alcohol to 1 drink max or skip it for the week as an experiment. After dinner, take a 10-minute gentle walk. Then, right before intimacy, do 60 seconds of slow breathing. Breathe in gently through the nose and breathe out slowly, slightly longer than the inhale. That long exhale tells your nervous system you're safe, which supports blood vessel relaxation. During sex, if you feel yourself fading, do the 1-breath reset. Slow down for a few seconds, long exhale. Soften jaw, soften belly, back to sensation. That's it. You're not overhauling your life, you're removing the 3 biggest evening saboteurs: overload, alcohol, and panic. Viewer participation prompt. If you try this for a week, comment "reset" and tell me whether your evenings improved even slightly. Because even a small improvement is a huge clue. Now, one more important layer. The goal is not unstoppable erections. That kind of language sets you up for performance pressure, and pressure is exactly what triggers the sympathetic system. The goal is steadier, more reliable function, and a calmer mind when things fluctuate. Bodies fluctuate. They always have. The difference is that at 25, you didn't care, and at 55, you interpret every wobble as a verdict. Let's take the verdict away. If you fade after dinner, it doesn't mean you're finished. It means your body is telling you it can't do feast mode and sex mode simultaneously the way it used to. That's not weakness. That's information. Let's close with a clear summary you can remember. Your penis often goes soft mid-sex after dinner because blood is diverted to digestion. And after 55, your blood vessels may be less flexible, so there's less reserve to support both digestion and strong erection at the same time. Heavy meals, refined carbs, dessert, alcohol, lying down too soon, and fatigue make it worse. Panic makes it much worse by spiking adrenaline, which tightens blood vessels. The fix is practical: smaller, smarter dinners on nights you want sex, better timing, a short walk, less alcohol, and a simple long exhale breathing reset to keep your nervous system in the right gear. And if the change is sudden, severe, or comes with other worrying symptoms, get checked, because erections can be an early signal of broader vascular health. And here's one last micro hook before you go. In the next video, I'll explain the healthy habit many men 55 plus do at night that quietly worsens erections and urinary symptoms, and the simple replacement that works far better. If you found this helpful, please like, comment, share, and subscribe. Stay healthy, be kind to yourself, and we'll see you in the next video.